Andy Burnham, hello.
Hi, how are you doing?
Yeah, good. How are you?
Well, strange times, aren't they? I'm probably trying to make sense of it like everybody else, but no, I'm good. This is second week of lockdown, and yeah, I think we're all adapting to a new norm, aren't we?
Absolutely. They are weird times, and obviously we're talking to you today in your capacity as Mayor of Greater Manchester, but also I think really illuminatingly, potential to be illuminating, is the fact that you are a former health secretary, and you were health secretary during the swine flu
Oh, it was.
pandemic. So, first of all, I'd like to start by talking about well, your assessment of the government response so far, in contrast to what you guys were doing and how you responded to swine flu back then.
Well, I would say they're broadly getting things right, and this is obviously a much bigger challenge than swine flu. Swine flu was a really serious situation. Let's not forget that. Sadly, a lot of people died as well. But I don't think it was ever at the scale that we're now seeing with coronavirus. So I was kind of prompted to think back at what we did by some of the things the government was doing and some of the things they weren't doing, some of the things they were getting wrong. A couple of weeks ago, I was one of those who called on them to have a daily briefing because you just need that steady flow of clear information. I also said they should have put experts more in front of the camera, and that I think has happened a little bit more. By no means did I get everything right back then, and I was saying I can remember making mistakes on the communication side of things. The key is facing up to them quickly and correcting them quickly, and I'm pleased to say the government has been doing that.
Yeah, there's I think it's important to say early on that obviously this is a state of emergency and we're reacting to something totally unprecedented, and that I don't think anyone wants to sort of put the political boot in, if you like, to the government.
No.
It's not constructive, but that doesn't necessarily mean that there's not room to scrutinise and to criticise and to explore where things have gone wrong. And I think one of the things that I would perhaps point to is the lack of personal protective equipment for our NHS staff, and this feels like something that's happened. We had February essentially. We started to get the data out of China in January. We realised that people were dying. This had the potential to be a global pandemic, and we didn't see those orders going in for the kits to make the NHS ready. And I just wanted your view on whether the government sort of acted quickly enough to the oncoming threat, if you like.
No, I don't think so. And I've been one of those sort of challenging them to do more, but doing it in a constructive way. Because I think the point you made is right. The public wouldn't forgive any politician for getting involved in what looked like a sort of tit for tat sort of point scoring match, would they? I mean, that would be unforgivable. So, I'm trying to point things out, but doing it in an overall context of trying to support what the government is doing. And we still have problems with protective equipment not reaching the front line. Only just on Saturday night, a couple of days ago, we got delivery of around 42 pallets that were going to go into adult social care, so into our care homes. That's great, but it's some way into this, and that the staff in social care, we rightly think about the NHS staff so much, they're often a bit forgotten, to be honest, and really on the front line as well. So I'm pleased that that's now landed, but I think it should have been done quicker. But yeah, no government can do a perfect response to something like this. This is going to test them on every single level. Some things they'll get right, some things they won't. The key is to challenge, but to challenge in the right way, and that's what I've been trying to do.
I think there's also potential that the government may struggle to, I don't want to say row back, but change some of the things that it's implemented over this period. So, for example, this is quite I don't want to say banal, but it is quite small by comparison to the pandemic. But free parking, for example, for NHS staff and things like that. It's difficult to see how a government, once we come out of this, once we get to the other side, could then say we're going to make our NHS staff pay for their parking again. Once the horror of this is over, there is the potential that we've sort of realigned our politics in a way for the better.
Well, you know what? I think that's right, Ollie, and I hope that is what happens here. We've been a pretty divided country, haven't we, for the last few years? Not just the referendum; it was even before that. There was quite a disconnect between public and politicians, and it's been building and building. And I hope that this might sort of flush that out a bit and bring people back together, and get some kind of more humane policies in place. I think we've had a tough decade, and now's not the time to sort of debate the ins and outs of austerity. But it's amazing what suddenly becomes possible in a moment like this, isn't it? The government saying, house all rough sleepers. Well, we were fully in support of that. We'd done it already before they were making that call. So it's kind of a bit frustrating. If we can say that now, well, surely in more normal times we can put a roof over everybody's head. I've been saying that for ages as Mayor of Greater Manchester. In a country as wealthy as ours, we should not have anybody, in my view, spending the night on the cold streets. I don't think that just has to be an inevitable fact of modern life. And I hope, if nothing else, we come out of this and say, right, rough sleeping is something we just do not want to have in our country. It's not. It lacks a basic humanity to let a fellow citizen sleep on the streets, and I that might be one thing I would say that could really come from this.
I suppose the critique will be, if we can do it in sickness, why can't we do it in health?
Well, exactly, and that's a fair point, isn't it? And I think there'll be a big reassessment going on across the board, to be honest with you. And I think, to be honest, it's not just in government. I think the public as well feel, I don't know, there's a greater sense of well-being that comes from looking out for each other. It gives life more of a purpose somehow, doesn't it? That we can actually sort of kind of come together and look out for each other. And I think it actually, in a funny way, builds a sense of happiness within people. So I do hope that that this moment, difficult as it is and will continue to be, in the end has a positive legacy for the country.
Yeah, I think it's that point you made there is really interesting, because the fact remains that not everyone can self-isolate, and I think this virus is exposing societal divides somewhat paradoxically in the way that it universally affects all of us. The Prime Minister has it. Obviously, a virus doesn't discriminate by class. But what's also true is the health of our nation relies on everyone's social distancing. And how can the homeless do that? We're now reliant on those that we've neglected and forgotten about for so long.
Oh, yeah, that's such an important point. And that became really clear, didn't it, over the last 2 weeks, really, as the government was trying to bring in policies to help different groups of people, homelessness and people sleeping rough, we've mentioned. But just look at all of those millions of people in what you would call insecure, casual work, self-employed. I think this has really exposed the fact that some people are living without the security that others take for granted. And, that's been an issue that's kind of crept up on us over the last decade. And I think it was really clear then in the way in which we had to do these quick policies to put a safety net back under people. I mean, really, that safety net should always be there, shouldn't it? And I'm kind of hoping as well in terms of the nature of work, we kind of have a bit of a reassessment when we get through this. So
there's a lot of people concerned about working conditions, being either forced or pressured into work in an unsafe way, whether that's because the confines of their job, they physically can't socially distance themselves, potentially on a construction site, for example, things that it's impossible to be 2 meters away from someone if you're filling concrete into foundations or things like that. Are you still hearing from people in those kind of situations? Because I know you set up a tip line, didn't you, for people to sort of report to you that their companies were making them work in an unsafe way?
Yeah, I mean, from the moment the Prime Minister made his announcement last Monday, people were contacting me saying, should I go into work? The message is stay at home, when, I'm under pressure to go into work. And then it kind of changed as the week wore on. People were saying, I am being brought into work, but I don't feel safe at work because they can't keep us 2 meters apart. Not just building sites, actually, warehouses, various establishments. So kind of seeing what was happening, and actually knowing that the government didn't have a clear policy on this, I set up an email address for people to complain to. And just a few days after I did it, we are now at around 1,000 emails has come into that email address. And that tells you there's a very real issue out there. It's a bit contradictory, isn't it, for the government to be sending police into parks and God knows where, but then leaving factories just completely as they were, and not observing the safe distancing. The Public Health England guidance says that businesses should follow the 2 meter rule where possible. Well, I'm sorry, those two words, where possible, are a get out clause, and some companies, I'm afraid, are exploiting that. My message to them all would be this: this is a national crisis. If you cannot keep your employees safe while they're at work, you shouldn't be open. I mean, it's as simple as that, to be honest, because it's not just unfair on them worrying about their own health. Some of those people will have kids with disabilities or underlying conditions, or they might live with elderly parents. Imagine how they must feel coming home from work, worried about what they might be kind of passing on inside the family home. I mean, that really isn't right. And that's why I'm going to keep on this issue until we get a clearer policy. I think the government needs to be absolutely clear. If your work is non-essential and you can't follow the rules, you now must close.
So yeah, just give me a little bit more detail there, because I mean, if that's your position, that if it's non-essential, you must close. I mean, how are we defining essential here? I mean, is it basically just food, medicine, basic infrastructure, and everything else has to shut?
I think it's things we need to live and be safe in this particular moment. There are other things that we might like to have in the long run, but maybe they're not so necessary. Now, if businesses can observe very, very strict distancing and have got sanitizer on hand for people to use, and the environment is clean, then okay, I'd be prepared, even if they were perhaps non-essential. You could see that why close something down like that if you don't need to? But I'm just worried that too many are exploiting it. And actually, there's millions of citizens of our country who can't follow the Prime Minister's advice, and that's not a great place to be in a pandemic, is it? You're being told to stay at home, and then on the other hand, you're getting dragged into work and sometimes into an unsafe environment. So yeah, we haven't got this right yet, and I keep pressing the government to go further.
So let's talk about the police a little bit then, because I went for my state-sanctioned walk yesterday, and the police were there at the park, dispersing people who weren't just getting exercise, people who were hanging out or whatever, drinking beers, because they were around. And that's something that we're seeing at the moment. But obviously, the police force are going to be equally as affected by this virus as everyone else is. There is the potential for a lot of police officers to be off sick at the same time and absent from work. Reports today that some forces may have to ignore low-level crimes because they simply don't have the staff due to sickness. What is Greater Manchester's contingency plan if your force does see, a 20 to 30% reduction in officers because of the illness?
Well, this is a very live issue, and the Chief Constable of Greater Manchester today is calling for testing also to be made available to his staff. Now, I appreciate NHS staff must come first and then social care, but also there is a need to get those tests into police forces as well, because, we need those staff back at work, and some are off work because they may think they've got it, but obviously if they had the test, they could find out and possibly get back to work. So that's been the focus for us in the last few days, to make that call to cascade the testing through different other public services and also into the police. Yeah, they've got a really tough job now, haven't they? I don't think any of them will be relishing wandering around giving people a ticket because they've been for 2 runs or because they've been to the shops twice. But it does sort of also beg the question, why are we doing that, but then not looking at workplaces where people are sort of standing side by side and potentially spreading the virus? I think it's not easy, I think, to be working in the police right now. And, I think they could benefit from clearer guidance from the government, but also the availability of testing. And I hope that is made available to them. On
that theme that we were sort of talking about earlier, and how this may realign our politics and realign our priorities, do you think the general public are going to start to see our public service workers in a different light? I think for the NHS, it's already, the NHS staff are already treasured in this country, but we're talking about, the police, potentially firefighters, potentially the army having to be deployed, not, guns on the street type way, but, delivering supplies, assisting where necessary, driving trucks, that sort of thing. Do you think we might start to see, a different appreciation, a greater appreciation for our public service workers once this is over?
I think it's a really interesting question, because I think you are right, that is happening. The public, in some ways, are making a re-evaluation of work and what jobs are, the value of jobs and the different things that people do. And it's not just public sector workers, isn't it? I think we all have a high regard for our supermarket staff right now, those working in the distribution chain. Sometimes jobs that are a bit hidden maybe, but all of a sudden you can see how crucial they are to us all. So I think that is going on, and I think people can see who really matters in the moment like this. But also, in public services, as I said before, social care is often a bit forgotten, and people who work in care homes are a bit forgotten. I just hope that that value of what they do is recognised. Bear in mind, there are some people working in those care homes who are not even on the living wage, looking after other people's parents. I mean, as a society, surely we must recognise that caring for other people's kind of mums and dads is like almost the highest calling you can answer in life, not the lowest. It's paid on a par with bar work or retail or whatever. Not that those things aren't important, they are. But looking after other people's relatives is kind of massively up there, isn't it? And I just find it really awful that in this country we think it's acceptable to pay people who do that below the living wage. And I just hope we get a proper funding settlement for social care and other public services out of this, and councils too. They have been cut to the bone, and we're asking a lot of council staff right now who pretty much are running on empty. And I hope there's a re-evaluation of all of these things.
So it's an interesting point you make there, because I think the food supply chain you would describe that as a public service, right? The availability of food to the general public. But in this country, that's something, in most countries, that is outsourced to the private sector. It's supermarkets that provide those things to our people, and the state actually relies on the private sector to provide those sort of things. And yeah, I guess it raises this question of, once we come out of this, will people look upon supermarket workers, cleaners, social carers in the same way that they did before, or will there actually be this sort of reappraisal and this reevaluation that goes, actually, these people are fundamental to the way that our society operates?
I really hope that is the case. As I say, we've become too divided in recent times, not just along political lines, but in terms of the nature of people's lives. There are some people who, let's say, are in salaried jobs, middle management, who are very comfortable, but they are above people, if you like, who have minimal security in their life. If they're on a 0 hours contract, minimum living wage. So I think this is a real thing that's kind of changed in our country in recent times. There are those who, it's not just about distribution of money, it's about distribution of security. Some people have a lot of it and some people have none of it at all. And I hope we reassess that, definitely. If you're delivering food to a supermarket, if you're cleaning a hospital, if you're looking after someone else's mum in a care home, those are really important jobs, and they need to be paid as such and recognised. And I hope people can see that more clearly now. And we don't tolerate poverty pay for those people. We do ask people at the top of organisations, take a pay cut. You're paid too much. I think there's been a real trend in this country of excessive pay over a number of years. And often people at that level of organisations are stripping the security away from those beneath them to pay themselves these inflated salaries. And I think we all need to get more challenging about that, because what we found here is people in that insecure position don't have the same resilience to fight this, do they? They're either pressured to go out to work, they can't afford to eat properly and look after themselves and their family, and that just simply isn't right. And a moment like this really shines a spotlight on all of that.
How important do you think maintaining some semblance of normal life is in times like this? People aren't allowed to go outside beyond the essentials, as we've already discussed. People can't see their friends or interact with them in the same way. How important do you think it is for people to maintain some level of routine, to reach out and to utilize technology to stay in contact with friends and family and try and live as normal a life as possible right now?
Yeah, it's interesting, isn't it? We're all trying to do that, aren't we? And
well, here we are now on Skype.
Yeah. And we've had the family conferences over Zoom or whatever, and it's challenging, isn't it? And I was certainly looking at all the football photos that were going around on Saturday, because I think people are starting to struggle seriously, aren't they, with the lack of football. I certainly am. There's been some fantastic sort of videos and things going around on that theme. I won't go into them all, but many of them at Liverpool's expense. But anyway, there's been some good ones. Good ones have kept me bit lifted in these difficult times. But yeah, I mean, you've heard about virtual pubs. I heard about someone who set up a virtual pub in their living room. We're going to do something in Greater Manchester starting this week. It actually began in Berlin, to be honest, and we borrowed it off them. It's called United We Stream, where they set up a streaming platform every night. They're using it, I think, for techno sort of bands or whatever.
Very Berlin.
We use it to promote Manchester bands, good old indie bands.
Yeah.
And we want to give them a platform at this particular moment in time. There's a real resurgence going on, actually, in Greater Manchester music at the moment. Wigan is just absolutely booming with bands. So we're hoping that the likes of the Lathams or Stanleys will come on. But we're going to get this thing going later this week. And I think the first act to headline will be the Slow Readers Club. They've just got an album out now called The Joy of the Return. And I don't know if you've heard it, but it's absolutely fantastic. And we're really pleased to give bands like that, who otherwise would be obviously playing to packed out kind of venues, album just coming out. You know, this is terrible for them, isn't it? They've been waiting for this moment, and their audience is in some ways gone. So we're trying to give it back to them via this new service. And yeah, we're going to try and do it nightly. So hopefully people might start tuning into it. Give Joe a bit of competition.
Yeah, well, good luck to you, mate. I think there's a very serious point here that I'd just like to explore, and I want to know what your message is to people, because, you know, it sounds trivial perhaps talking about gigs and nightlife and pubs and all this sort of stuff, but actually they're fundamentally important to who we are as people. You know, those social interactions, those good times that give us that enjoyment that a lot of people would probably say the meaning and the happiness in their life, and they can't see that right now. It's a million miles away, and I wonder what you have to say to people who perhaps, I mean, they might even be feeling a bit of despair at the moment. They might not be able to see you know, a light at the end of the tunnel. What do you have to say to people who are feeling that way? Yeah,
it's a really, really good question. It's just a different life we're living, isn't it, at the moment? You know, we're probably all spending a bit more family time. For those of us who have family, I think the dog has never been walked as much and all of that, you know, and a lot more kind of chats happening, and that's all great. But I am very conscious that there'll be a lot of people out there living on their own. And as we get into week 2, week 3, week 4 of this, it's going to become increasingly difficult, I think, for people. And that is one of the issues that's quite high up my agenda at the moment, as I'm thinking about what more I need to do to support people in Greater Manchester. We need to think about the mental health and well-being of people as we get deeper into this, combating that social isolation. So you're right, you know, that we're going to find other ways of people connecting, haven't we, and interacting. And helping people who perhaps are living alone to tap into something then that will give them that bit of company that will lift them out of a difficult moment. So yeah, it's kind of having to rethink all of these things, isn't it? But I'm looking to see if we can make some mental health support available to people at the Greater Manchester level to get them through this, because I think we're all finding, aren't we, that at different moments of this, there are kind of challenging sides to all of this, aren't there? And it's going to impact on people, and we just need to think about ways of helping them lift themselves out of a difficult time if that's what they're feeling.
Andy Burnham, thank you very much for taking the time. I really
You're
appreciate
welcome.
it. Cheers, mate.
Thanks, Oli.